So although Gower sign may be an early symptom, there definitely needs to be a lot of other testing done to confirm that it is MD. Elevated creatine kinase or enzymes due to the muscle breakdown, we had talked about that. They will undergo EMG and muscle biopsies, and of course, since it is a genetic disease, they will undergo genetic testing to get a confirmation of what type of MD it is. And so if you look at this loss of ambulation in Duchenne and Becker muscular dystrophy, so if you look at the ages, so you can see 10 to 14, there is a large jump in the number of kids who are using wheelchairs between the ages 10 and 14. And so once again, the students who've worked at the camp, that is a big part of their work, is to assist these students, particularly during the night, because these children don't have any control of their bodies and they can't even turn over in bed. So something that we take for granted, they have to really help the youth to be able to do that. Complications from muscular dystrophy. So, it affects the entire body and it will affect the respiratory muscles. So in addition to the wheelchair, the children may eventually need a ventilator, can, cause heart failure, severe contractures, weakened bones, and it makes sense because they may be using prednisone and because they're non-weight bearing. Scoliosis, so restrictive lung diseases can develop. Risk of diabetes because of inactivity, weight gain. They may be able to walk with braces if they're in the early stages. So, but unfortunately, once they get to a wheelchair, that they usually end up staying there. In exercise testing, in early childhood, there could be totally normal. Oftentimes, researchers will test grip strength with the grip dynamometer, isokinetic and isometric strength through the Biodex. So the higher the strength loss, it higher correlates with disease progression. Cycle ergometers, flexibility, again using goniometers to evaluate contractures. They may need pulmonary function testing, spirometry, and then body comp, bioelectrical impedance or BOD-POD. You're not really going to be able to do skin fold type of measurements on them. Exercise training. There is no evidence that exercise does anything to make their disease worse. So they can, exercise the muscles that they can use. Muscles that are least affected, not surprisingly, are going to respond better. So the camps really try to make activities fun for kids. They can do resistance training. They may need to, watch for intensity because that can potentially exacerbate muscle protein breakdown. If you see any myoglobin, if their urine starts to turn dark. Flexibility training, anything to improve their range of motion, to lessen the amount of contractures. And just for safety reasons, they shouldn't exercise alone because if they fall, they can't get up, and if they have any emergencies. And watch for sensitivity to heat as well. So typically, use with MD, they're going to have a team of physicians. So they'll have physicians, PTs, OTs, dietitians. They can be sleepy during the day. It can be hard to get them to be motivated. And, exercise can help them feel normal. And somewhat similar to what we saw in persons with spinal cord injuries is they can get this malignant hypothermia, which is an uncontrollable rise in their body temperature. So remember, in spinal cord injuries, it was blood pressure. And so overall, they have very low physical activity, energy expenditure. So they have to keep an attention to diet as well. And, as one of the students was saying who worked at the camp, the one boy, his parents sort of let him eat whatever he wants, and that's not good because it becomes difficult to care for him, to try to move him, to get him in and out of the wheelchair. So, so paying attention to weight management issues in these kids is important. And, so they could have also nutritional deficiencies.